Hello, and welcome to another episode of Dr. Carri's Clinical Corner. And today, this episode is for women over the age of 50 who have bladder urgency and frequency, meaning like you feel like either you always need to go to the bathroom, or number two, you feel like I can't quite make it there, or I'm afraid I'm not going to make it to the toilet. I see you in the clinic all the time. I see women like this in my clinic all the time, where we can do all the tests and do all the things. And majority of the time, they have no pelvic floor weakness or tightness. Like some of them do. I would say some of my older clients, that's a piece of it. But majority of the time, their pelvic floor is mostly working just fine. What I think is happening is this is sort of an accumulation of habits over many, many years. I see this in other clinical things too. Like if you're an athlete or you have a job where you're doing the same repetitive motion all the time, that eventually catches up with you. So I think in women over 50, especially, their bladder habits catch up to them. I see this in some younger women too, but I really, really see it in my older women. So this is for you guys, you ladies. I don't really see it in men. Men, it's usually a prostate issue most of the time. So lucky ladies. But what I want to say is, often what's happening is why you feel like I can't make it to the toilet or I always need to go. It's a lifetime of these little poor habits that become an issue. And so that's really why I created my online bladder course, because I see you in the clinic and I'm like, you don't need to do Kegels. You don't need to do stretches, maybe a little bit, but I don't think that's the main thing. It's recreating better bladder habits. So what I mean by this is, in your younger years, you're like, do I need to go? I'm not sure. Let me just go pee. And then it becomes a habit. Every time I think I need to go, I go. And then over time, our bladder kind of shrinks and it can't hold as much. And also I think the signals get confused. So normally we get a signal our bladder's like a water balloon. So normally we get a signal when it's 40% full. That oh, it's full, but I don't need to go to the bathroom yet. And then when it's 80% full, it's I need to go to the bathroom. And I think what happens over years of sort of I kind of need to go, I'm going to go, over time, then your bladder thinks that's when I need to go. And so we got to sort of re-establish better brain bladder connections. And that will help you. And then also I think that sort of feeds into the urgency, I'm not going to make it to the toilet, because again, sort of a lifetime or many, many years of habits of I'm going to go to the bathroom before I go out, or oh, I'm home, I need to go to the bathroom, right? And that combined with going more frequent and our bladder shrinking sort of creates this urgency. I'm not sure I can make it to the toilet. So again, that's not really a Kegel issue. I'm telling you, I see this in the clinic over and over. I feel like a lot of online creators stop doing clinical work and sort of get out of touch of what's happening. Not all, but I'm here to tell you, I work in the clinic. I see women, I see patients every week, and this is what I see. And I used to sort of think what's going on? Their pelvic floor isn't weak and it isn't tight. And then I really started leaning into teaching them better habits. And then I was kind of they don't really need to be seen in person. So that's why I created my online bladder course. So if you're a woman over 50, you can take my free introductory online bladder course to sort of learn a few habits and try those, and then see if you want to learn more. But I'm telling you, creating better habits is the game changer for the majority of my patients. So again, you don't have to be over 50. I do see it in younger patients, but it's most common in my older women. That just these bad habits, same thing. So if it's bladder urgency, bladder frequency, that's really, really why I created this online bladder course. And then I expanded it to create, to talk about other scenarios too, like bladder leakage with exercise and coughing, sneezing, things like that, because I wanted to just make it a comprehensive bladder program to teach you all the things. But originally I created it because I was like, I don't really need to see these people in the clinic. So go sign up. I'll put the link below. Sign up to take the free introductory course. Try those habits, implement them. Like, really, you got to do the work. Like, to me, the solution is simple, but you have to do the work. There's no magic bullet. We all want that. I think especially in American healthcare and American culture, we want the like instant gratification. You have to do the work, and it takes a little bit of time, but if you do the work, most of my clients, they see some changes either immediately or within the first 2 to 3 weeks. And then depending on the severity of their bladder issues, it takes probably like 3 to 6 months. But then they're good, like maybe we got to go back and revisit. But if you do the work and you change the habits and you make better habits and you make a conscious effort, things can get better. And you don't have to be that 70 or 80-year-old with bladder leakage, wearing diapers. I can't go anywhere. It doesn't have to be that way. So do the work, get the information, do the work, start with my free bladder course.